The charity fund in the sphere of support of social and cultural initiatives of Leila Adamyan presents Disorders in the functions of reproductive health of women and correction methods. Dear colleagues, good day. Please raise your hands if you have just come to the second half of the conference for the first time. Alright, we have such people. Now, this scientific and practical conference is exclusively educational. It is dedicated to the most topical issues of female reproduction, dysfunctions in their reproductive health and methods of their correction. This conference is about the most common problems with which young women go to a doctor, starting from the period of menarche or childbirth period. It is about transitional period of the climax, menopause, hot flashes. It is about contraception, and not some standard issues, but the curative aspects of contraception. And in the end, it is about anti-age therapies. How to maintain good health, attractiveness, high quality of life at all ages, and how to make sure that our old age is a joyful time, not only for us, but also for others, in the family, for our husbands, society. The lecturers who have been selected for this conference are professors who are well known in the city, in the country and abroad. It is the chief obstetrician gynecologist for children and adolescents of the city of Moscow, Professor Elena Sibirskaya. Please greet her. It is the director of the Institute of Reproductive Medicine of the Russian Endocrinological Center, Professor Elena Andreeva. It is Associate Professor Kasyan from the Department of Reproductive Medicine and Surgery. It is Associate Professor Tatyana Kaznacheva from the Department of Reproductive Medicine and Surgery. Dear friends and dear colleagues, I'm very pleased to welcome you here in this room. Menstrual pains, dysmenorrhea, causes and treatment. Unfortunately, no matter which woman or girl we point at in this room, or which woman or girl who is sitting at the monitor watching us, each of us has felt pain during menstruation. This is what we call dysmenorrhea, or pain during menstruation. Dysmenorrhea is composed of three Latin words: dys, which means bad, meno, which means months, rhea, which means bleeding. I'd like to note that the dysmenorrhea is a socially significant problem. Why? Because it is the main reason for girls' absenteeism in schools. On average, from 10 to 48% of women temporarily lose working capacity, and it directly affects family relationships and women's quality of life. According to the epidemiology of the United States, about 600,000 working hours and $2 billion are lost every year because of that. The prevalence of dysmenorrhea. On average, it ranges from 43 to 89% of patients who have pains during menstruation. But before talking about the causes of pains during menstruation, I'd like to focus on what is a menstrual cycle. It is a physiological process characterized by changes in the body of women, manifested in bleedings from the genital tract. The menstrual cycle has several phases: follicular, ovulatory, and luteal. But the most important phase for us in this issue is the phase of desquamation, or rejection of endometrium, or the menstrual phase. If the vicious psychological circle, which we all know, is broken, it is only for the better. But it is not so in the hormonal regulation of the menstrual cycle. In here, any disruptions lead to serious consequences and potential development of pains during menstruation. A normal menstrual cycle must be painless, and the girl or woman can perform any kind of physical activity without any problem. According to the data about the causes for emergency hospitalization of girls, the primary dysmenorrhea takes the 4th place. I'd like to mention that there are certain risk factors which result in pains during menstruation. They are physical stresses, family anamnesis, early arrival of menstruations, bad habits, especially smoking, physical traumas, sleep deprivation, hypovitaminosis and profuse menstruations. Dysmenorrhea may be linked with a family history. On average, in 30% of cases, if a girl experiences pain, this pain during menstruation was also experienced by her mother or grandmother. At the end of the last century, the severity of primary and secondary dysmenorrhea was classified. I'd like to note that when the severity degree is 0 or 1, the pain is negligible. When the degree is 1, anesthetic medication may be required, which always has a very good positive effect. When the pain degree is 2, there are expressed neural symptoms, intense pains, but the pain can be eliminated by painkillers. When the dysmenorrhea severity degree is 3, in most cases it may require hospitalization. To assess the pain degree, we use a scale of pain. In terms of prevalence, severe dysmenorrhea happens only in 15% of cases. And it is very good that the slight degree of dysmenorrhea happens in 34 to 40% of cases. There is a dysmenorrhea classification which divides dysmenorrhea into primary, secondary, and unspecified dysmenorrhea. I'd like to note that primary dysmenorrhea starts in the menarche period and only after the arrival of menstruations in girls. With this type of dysmenorrhea, there are no organic pathologies in the genital organs. Secondary dysmenorrhea occurs in women of older age. It is always accompanied with some organic changes in their reproductive organs, and it is manifested in abundant and prolonged menstruations or blood discharges between menstrual periods. I'd like to note that unfortunately things do not always happen in our life the way we plan them. A variety of situations may occur that can deteriorate the course of the process. The same thing happens with the etiology and pathogenesis of dysmenorrhea. There are a number of theories, among which are the prostaglandin theory, vasopressin hypersecretion theory, hormonal theory, and hereditary theory related to the dysfunction of the spinal interneurons. And there may be a combination of these theories which may further deteriorate the course of the process. What is the pathogenesis of primary dysmenorrhea? They are increased production of prostaglandins, contraction of the uterus, which cause vasospasms, ischemia, or oxygen deprivation, and it causes pain. In the etiology of secondary dysmenorrhea, there must always be, as I said, an organic component, such as endometriosis, malformations of the uterus or vagina, inflammatory diseases in the uterine appendages and the uterus itself, tumors of the uterus, stenosis of the cervix, adhesions in the pelvis. The pathogenesis is associated with the problems in the blood circulation in the body, irritation of the neurons, spasms of the smooth muscles, stretching of the organ walls, which cause pain. What are the symptoms of dysmenorrhea? They are depressions, pains in the heart, in the joints, sweating, intestinal disorders, which manifest themselves in the form of tenesmus, diarrhea, nausea, vomiting. The symptoms that accompany secondary dysmenorrhea are infertility, intermenstrual discharges, profuse menstruations, painful intercourse, pelvic pains. One of the contemporary theories of painful menstruation states that pains occur due to a magnesium deficiency, and this deficiency may be accompanied with all the earlier mentioned symptoms. What are the functions of magnesium in the body? They are antidepressant, antispasmodic, antithrombotic, and antioxidant effects. And also magnesium increases the production of prostaglandins, which are involved in causing pains. What causes magnesium deficiency? It is caused by chronic stresses, poor diet, lack of vitamins, especially vitamin B, abuse of harmful substances, use of laxative, use of hormonal contraceptives, pregnancy and breastfeeding. Diagnosis of dysmenorrhea is based on the medical history, gynecological examination, additional methods of examination such as electroencephalogram, ECG exam, evaluation of the vegetative and psychoemotional status of the patient, and, if necessary, conducting tests with non-steroidal anti-inflammatory medicines, and assessment of the concentration of trace elements in the blood, especially concentration of magnesium in the blood. Also, additional screening methods such as ultrasound, if necessary, magnetic resonance imaging, and possibly invasive examination methods such as hysteroscopy and laparoscopy. This way, with these differential diagnostic methods of primary and secondary dysmenorrhea, it is important to emphasize that primary dysmenorrhea occurs mainly in girls during the period of occurrence and arrival of menstruation. The pain occurs the day before the arrival of menstruation and may last throughout the menstruation period. Other causes are obstruction of the blood outflow from the uterus, disruption of the synthesis of prostaglandins, high pain threshold, and possibly malformation of the internal reproductive organs. The differential diagnostic methods are obligatorily performed when there is an acute gynecological pathology such as torsion of the ovarian cysts, ovarian apoplexy, or when there is an acute surgical pathology such as acute appendicitis, urinary tract infections, and neurological disorders. The main goals of treatment of painful menstruation is elimination of the pain syndrome, normalization of the autonomic nervous system, normalization of the menstrual cycle, and elimination of organic causes if they are present. Medication. We use first-line medicines containing magnesium salts, non-steroidal anti-inflammatory drugs, antioxidants, progestin, monophasic contraceptives, and sedatives. Non-medicinal treatments include adherence to a right regimen, balanced nutrition, therapeutic exercises, psychotherapy, reflex therapy. I'd like to say a few words about the risks of dysmenorrhea. It says in a well-known Russian song, "Nothing on earth passes without leaving a trace." The same thing is here. If dysmenorrhea happens at an early age, it may develop into severe anxiety, depression. If it happens in women of reproductive age, it may cause infertility, risks during pregnancy and delivery, endometriosis, uterine tumors. If it happens in women of perimenopausal period, it causes depression, worsening of fibroids, and endometriosis. Prophylaxis of dysmenorrhea is based on compliance with a healthy lifestyle, preserving pregnancy, balanced diet, which should be rich in magnesium, elimination of magnesium deficiency, stresses, use of natural breastfeeding, and maintaining positive emotions. As for positive emotions, I would like to dwell on that a bit more and wish our audience happy upcoming holiday, the 8th of March. I wish you all happiness and health. And I want to emphasize that we must struggle with pain, because the pain during menstrual periods on average takes away 5 to 6 years of our normal life. And also do not forget about medical examinations. These examinations help to identify the initial stages of gynecological diseases. We're always open for communication and always ready to help you. In concluding this presentation, I'd like to thank you all for your attention. Once again, I wish you a very happy International Women's Day, wish you happiness, strong health and good luck. I wish you to love and to be loved. For a woman, it is a great happiness. Thank you. Thank you very much. See you at the next conferences of the Open University of Leila Adamyan.